Babies that died before they even had names, before their parents had even had a chance to name them. Viewer, you already know the story about the neonatal care center in India's national capital, Delhi, that burnt down on Saturday late in the night, killing 6 newborn babies. That number has now turned to 7. And you don't normally need any reminding about how cheap life is in our country, but please bear with me as I tell you just how cheap life has proven to be with this new case. It's even cheaper than you thought. First, this East Delhi hospital where this tragedy took place had been running without a registration for 2 months. It was, in other words, an unlicensed and unregistered hospital. A license issued by the Delhi government's Department of Health had expired on March the 31st, and yet the facility continued to run and nobody even knew anything about it. Second, the hospital did not have clearance from the fire department. It did not have a mandatory no objection certificate to function. Its test equipment was on the ground floor with the newborn infants kept on the first floor. Third, the hospital didn't have a single emergency exit, nowhere through which a rapid rescue could have been conducted. Shocking images prove this. They show the police and the fire department removing the babies via a back window. Fourth, the hospital did not have a fire extinguisher on its premises. Think of what it would take to just have a simple fire extinguisher, a low-cost piece of equipment, and it wasn't there. Fifth, the hospital did not have a qualified doctor on duty, a mandatory requirement for all neonatal care facilities. The entire point of a neonatal care facility is round-the-clock monitoring because these are newborn babies, anywhere between a few hours old to a few days old. They could require emergency attention at any time of day or night. They are there precisely because not everything has gone right with their birth, but they didn't have a professional, qualified doctor on duty that night. Number 6, the doctor who happened to be on duty had a bachelor's degree in Ayurveda medicine and surgery, not the qualification required for round-the-clock care at any time in such a facility. Number 7, the hospital which, when licensed, had been authorized to care for 5 babies, no more than 5 babies at a time, had over double that number. 12 babies in its care at the time of Saturday night's fire. It was therefore running at more than double its authorized handling capacity. Remember this number, viewer. Authorized for 5 and handling 12. Because of the 12 babies, 5 babies were saved and undergoing treatment now. If the hospital had obeyed its capacity restrictions, perhaps there would be no deaths in the fire. Perhaps all the babies would have been saved if there were only 5. And finally, violation number 8, an unauthorized oxygen cylinder racket was found to be operating on the hospital premises. As many as 32 oxygen cylinders were illegally found to be present on the ground floor, right below the floor where the babies were. I've listed just 8 violations, viewer. As you have seen in our reports, the parents, the families of these dead newborns aren't people of privilege, not a single one of them. They're all ordinary folk. Many of them are poor, none with the means to put their newborns in expensive neonatal care facilities, in big hospitals. With government hospitals burdened beyond capacity, even in the national capital, private hospitals routinely refer their poor patients to small neonatal care hospitals like the ones where these 7 babies died. 7 babies, wrapped in tiny sheets, their time on earth counted in hours. Their anxious parents had placed their trust in one among hundreds of such unauthorized centers to give their newborns a fighting chance at life. And now there is only darkness, only the worst that new parents can imagine. The only question, therefore, viewer, is this: will those whose jobs it is to ensure such hospitals do not operate pay the price? Or do we once again normalize the blood of babies?